So next up, we have Elaine Richard. She's the CEO and founder of My Cure All. Now, Ms. Richard is a highly seasoned pharmacist and healthcare professional that has held leadership roles in 3 Fortune 500 companies that include Rite Aid, Walgreens, and CVS Caremark, just small companies. Ms. Richard is a graduate of Long Island University School of Pharmacy and has been a licensed pharmacist in New Jersey and Florida for over 20 years. Ms. Richard wants to make our society a better place, and her goal is to decrease opioid overdoses, decrease deaths from suicides and overdoses, reunite families suffering due to drug addiction, and help patients achieve the most effective pain control. Ms. Richard is dedicated to providing quality patient care and ensuring improved clinical outcomes. In her 20 plus years as a pharmacist, she has seen tens of thousands of patients for dozens of different conditions.
What is he reading?
As a pharmacist, she has always strived to help patients make their lives happier, healthier, and ease their burdens. Addiction is a tough illness, and she feels honored to help patients on their road to recovery. Now, at My Cure All, her mission is to optimize innovation to treat pain properly while preventing addiction at its core and ensure improved clinical outcomes. Welcome, Elaine. Glad you could join us.
Jim, well, thank you so much for this really wonderful introduction. I really appreciate it. I am honored to be here. Thank you, Brad, for organizing this. And I am actually very glad that I'm following Emily and David because I will be talking about medical part of cannabis as well. So hopefully, it's a nice actually follow up for me. So hello, my name is Elaine Richard. I am a founder and CEO of the company called My Cure All. Our company built an ecosystem to navigate the medicinal cannabis world, the My Cure All app. Our team of pharmacists, social workers, and substance abuse and mental health professionals brings pharmaceutical precision and extensive experience to the field of medical cannabis. So I've been a pharmacist at this point for over 25 years. I've worked for different companies. I've owned my own stores over a period of time as well in the beginning of my career. What brought me to the cannabis world several years ago was my interest in alleviating the scourge of the opioid epidemic. And what I've noticed is how much cannabis can actually be utilized as part of the MAT treatment in opioid reduction therapy. And that's kind of how my interest started several years ago. And I became the first full-time employee of my company as of June 1st of last year, 2019, and started researching medical protocols and building our app. So one of the things that our app, my web app, provides is a platform for targeted cannabis recommendations for strains, dosage forms, and ratios and strength to treat specific medical conditions and lower healthcare costs. So the reason we created the app, as I mentioned, was from the desire really to fight that opioid epidemic and to provide protocols for a far more superior medical treatment option, which is cannabis, with far less side effects and no addiction potential. But other than medical protocols, what else can a platform like ours help you with? What exactly does it mean to be a patient, a provider, or a dispensary, or even an insurer on our platform? So what I would like to talk about today is about drug interactions, side effects, synergistic activity of cannabis, and part of my talk will be about the cannabis, will be about the opioid epidemic, because this is what our app actually provides. It provides that platform of cannabis protocols for different medical conditions, and as well as I will be touching base on some microdosing as well. So many drug interactions are caused due to a medication acting as an enzyme inhibitor or an enzyme inducer. For example, most everyone on this call is aware that eating grapefruit or drinking grapefruit juice can affect some of your medication. In most cases, it increases the level of the medicine in your blood. This can increase the risk of side effects or alter the effects of medicine that medicine has. The enzyme inhibitor slows the metabolism of another drug, which can cause higher drug levels and side effects of the drug that is affected. And an enzyme inducer, which in this case would be THC, speeds up the metabolism of another drug, making it less effective or even causing withdrawal symptoms in certain cases. So obviously cannabis is no different. Cannabis is still, even though it's a natural product, cannabis is still could cause side effects. So drugs that are metabolized and eliminated by enzymes in the liver, they're called a cytochrome P450 family of enzymes. Because both THC and CBD are metabolized by those enzymes, cannabis is involved in many drug interactions. So CBD, first and foremost, is a strong inhibitor of all of those cytochrome P450 family of enzymes. And because the cytochrome P450 family of enzymes involved with metabolism of about 50% of all drugs, CBD may increase levels of a lot of drugs. So first and foremost, I want to mention a Z-Pak. So been a lot in the news lately, along with black vanilla hydroxychloroquine. So actually the dosing of Z-Pak will be increased naturally in your body if you're ingesting cannabis. Erythromycin would be another antibiotic as an example. A lot of blood pressure medications from the family of calcium channel blockers, from the family of beta blockers, atenolol, verapamil, diltiazem, will be increased with the usage of cannabis. Benzodiazepines that are used to treat PTSD, anxiety, sleep disorders, such as lorazepam, diazepam, clonazepam, alprazolam. Some of the erectile dysfunction drugs will actually, due to the ingestion of cannabis, the patient will actually have a prolonged erection. So Viagra, Cialis, Stendrol, Levitra are all part of those drugs. Some of the cholesterol medications, which are very common, such as Zocor and Lipitor, and in this case, cannabis utilization with Zocor and Lipitor, if not monitored, can actually damage your liver. Family of the cytochrome P450 enzymes also metabolizes many antidepressants. So CBD specifically may actually increase levels of these drugs in your body. So SSRIs such as Celexa, Prozac, Lexapro, Paxil, and many others. And that brings me to opioids. So levels of opioids such as oxycodone, codeine, hydrocodone, morphine, tramadol increase when CBD or cannabis are introduced. The interesting thing about this is that it proves that endocannabinoid system works in conjunction with opioid receptor sites. The vaporized cannabis increasing the pain-reducing analgesic effect of opioids without altering the plasma level of the opioid. So a study was performed in 2018. It was a non-control open label study on 274 participants. It was conducted by Beth Wise and Adrienne P. Wilson-Poe, and it was later published in US National Library of Medicine. And it clearly found that medicinal cannabis reduces the consumption of opioids. So the current research, and I'm sure everybody on this call is aware, the current research generally supports the use of medical cannabis as an adjunct or additive to opioid substitutes. Furthermore, patients prefer cannabinoids to opioids, and the same patients are showing a 40 to 60% reduction in opioid abuse for pain with fewer side effects from the medication. They're showing improved cognitive function, better quality of life with cannabis instead of opioids. Despite that vast array of cannabis products and administration routes used by patients in states with medical cannabis laws, cannabis has been consistently shown to reduce that opioid dose needed to achieve desirable pain relief. In further reviewed research, we can see the benefits of supplementary use to address traditional medication-assisted treatment in intervening with administration of cannabis and showing findings that produce synergistic analgesia. So cannabis and opioids have this great synergistic drug interactions, have this great synergistic effect. So the research that I'm referring to has concluded that clinical data that analgesic synergy produced by co-administered cannabis and opioids will actually will show greater pain reduction with clients that are receiving either opioids or cannabis. So this strategy could have significant impact on opioid epidemic, which what brought me to the cannabis field, and given that it could entirely prevent two of the hallmarks of opioid misuse, dose escalation and physical dependence. We can actually conclude that the evidence support the role of cannabis in acute non-severe pain management and leads to substantial reduction in opioid prescription rates, therefore reducing society's dependence on opioids. It further highlights the needs for additional research and on the efficacy of cannabis as opioid replacement therapy. So again, this drug interaction is called synergy or synergistic analgesia, and it shows that the reception sites, that it's using the same reception sites, and it's a great welcome interaction that can be effectively used to assist all of our patients. I touched on CBD, so I just wanted to do a quick touch up on THC. THC also has some interactions by inducing the same cytochrome P450 family of enzymes. Therefore, THC can potentially interact with any of these drugs that I mentioned, lowering the levels of the drugs in the body, especially making less effective antipsychotics. So Thorazine, Haldol, Zyprexa, some of the muscle relaxants such as Flexeril, and even an inflammatory such as Aleve. Some of the other notable drug interactions that I want to mention is THC and CBD both increase warfarin levels, which can actually increase bleeding risk. I'm sure a lot of people know that alcohol will be increasing the THC level or vice versa. Combining cannabis with tobacco can cause increased respiratory symptoms. And cannabis used with sedating anticholinergics may cause additive tachycardia and drowsiness. Various factors may affect drug interactions as well, such as the CBD-THC ratio and obviously a strain profile. In general, short-term effects of cannabis may include a sense of euphoria, altered sense of time, mood changes, impaired body movement, difficulty thinking or problem solving, and impaired memory. Other physical effects of cannabis may include breathing problems, such as daily cough, phlegm, more frequent lung illness, higher risk of infection, increased heart rate for up to 3 hours after smoking cannabis, which can actually increase the risk of myocardial infarction. The risk is high in elderly and patients with known cardiovascular disease. Data on drug interactions with medical cannabis is still being researched, so we do not yet have a full picture of all possible drug interactions, and there may be many more that we don't know about yet. The next thing I want to talk about is the microdosing, because that's something that I find extremely interesting, is microdosing cannabis, especially in people with severe issues, with severe medical conditions. So the catch with cannabis, especially if you're using it medicinally, that no doctor can actually tell you the perfect dose. So microdosing relies very heavily on trial and error because THC, CBD, and other compounds activate and mimic the body's natural endocannabinoid system. And those receptors function differently in everyone. Plus, other aspects of personal chemistry like tolerance and metabolism also play a role. And obviously genetics, which is something that I'm really looking forward to exploring in the later years. So just to conclude, I want to, kind of bring us back for why MyCureAll is a need and such an important part of the medical cannabis recommendation process. While medical cannabis is being established in the scientific community as a medication of choice for many conditions, the current method of prescribing is inadequate. The MyCureAll web app enables patients, physicians, dispensaries, and insurance companies to work hand in hand to achieve a natural solution to a plethora of medical conditions. We're allowing patients to actively participate in their treatment and to take ownership of their healthcare, which to me is their own personal cure-all. Patients let us know what medication they currently take and what symptoms they want to alleviate or what condition to treat, and we provide them with the best medical protocols. Prescribers have been complaining about lack of proper education about the endocannabinoid system and are frustrated for not having standardized protocols based on patients' age, sex, medical conditions, self-reported symptoms, and potential drug interactions. Will now have MyCureAll that provides that perfect solution for that. An ecosystem to navigate the medicinal cannabis world. And the last thing I do want to mention is that we have patent pending technologies, Cannameter and Cannameasure, which allows doctors to identify and recommend specific strains, ratios, and cannabinoids for qualifying conditions and presenting symptoms. taking the guesswork out of prescribing medicinal cannabis. The data that is that's been fed into our Cannameter and Cannameasure comes from our team analyzing 356 studies, which demonstrated that not all available strains treat symptoms and illnesses in the same way. The cannabinoids and terpenes that make one strain ineffective at treating irritable bowel syndrome might make it highly effective at treating symptoms associated with cancer. While the composition of another strain might make it a useful remedy for anxiety, it could be a very wrong choice for someone looking to treat Tourette syndrome. So as patients, doctors, and dispensaries share their own experiences with strains in our app, we're actually able to help and improve our algorithm. Thank you very much.